Hi, it's me, Ingrid INFP, and this is Medical ABCs or Medical Literacy by a licensed MD doctor, which is me. I keep forgetting that I actually am an MD. Um, I am a medical resident, so I'm not a full-blown professional, but I am doing my residency in general practice, and I do have to give that disclaimer that I am not your doctor. I do not know your personal health conditions and what is safe for you. I can just tell you a little bit better maybe than WebMD can about like what is dangerous and what is not. And like I refer you to your doctor in case of any questions. I know that it's not always easy to go to the doctor, and especially in the US where everything costs like crazy amounts of money. So that's why I'm giving my advice. But also, obviously, I also live in Sweden, so it might not apply to you. And so we were talking about the stomach last time and the abdominal problems, but now I'm going to be talking about urinary problems. So problems peeing. Okay, we have great discussions on this channel, don't we? So problems peeing, urinary infections, UTIs. So UTIs are often a bacterial infection. Often it goes like it comes and it goes, and you don't need any antibiotics. Just make sure to drink a lot of water. Make sure that you keep a good hygiene when you wipe yourself, and check if you have blood in your pee, but not everything that is dark pee is actually blood. I've had people come absolutely convinced that they had blood, but it was actually just that it was very concentrated because they hadn't had anything to drink all day. You need to drink 1.5 liters of water a day. I don't know what that is in gallons or in whatever other things that you guys use, but that is in general the rule. Some people need to drink 2 liters of water a day. Women have more UTIs than men because generally the anatomy looks different, and where we poop and where we pee is very close to each other compared to men where it's two totally different areas. But it is more of a problem if men get a UTI because the urinary tract is much longer in men, for obvious reasons. Okay. So what can happen? It hurts when you pee, that burns. You might have stomach pains and problems after you have peed, or you might have that you have to pee very little, very often, and it often lasts a few days. And sometimes you might see blood in your pee. That has happened to me, and I got super freaked out because I was medical resident, and that is scary because I started thinking, but it's not always bad to have blood in your pee, but it is a sign that something's wrong. So go to your doctor about that, because sometimes it can be other things that might be lurking behind your urinary infection. If you have a fever and have urinary problems, go to your doctor, because you might have a urinary infection that has gone up to where the kidneys are, and we don't want pain there. Usually the doctors will test if your stomach hurts higher up than it should, or if you have pain in your back as well. And fever is not good to have when it comes to urinary infections. So that is about that. If you have a kidney stone, you will know, okay? That gives extreme pain. in your stomach, and you might be unable to pee. It might be blood in your pee, and basically, people with kidney stones, they want to move all the time. They cannot lie still, and there's a stereotype, or like the school book example of like they're creeping on the walls, like they're crawling on the walls, like they're trying to find a position that works, but there's no position that works. And often the kidney stone will be peed out on its own, and it will be okay. And often people that go to the emergency room, the doctors are just waiting for it to get peed out. It might be checking your urinary samples pretty regularly, give you pain medication, either rectally or IV or subcutaneously, with anti-inflammatory or morphine. But in the end, it should leave on its own. If it doesn't leave on its own within a certain amount of time, the doctor might do an X-ray to find how big that kidney stone is. Often the kidney stone will be peed out, but sometimes it won't, and so sometimes it needs to be operated on, and sometimes they can just crush the stone through ultrasound waves, I think. I don't know exactly what happens, but they don't open you up to fix the kidney stone problem. But that's where the surgeons, they do their thing. I'm not an expert on that. But that is about this problem. When it comes to other urinary problems, that's mostly the urologist's realm, but it's also the gynecologist's realm when it comes to women. Before we go into that, I wanted to point out that men with urinary tract infections sometimes can have a problem with getting out all the pee from their bladder. So they might need to you might need to do an ultrasound of your bladder to see if there's a lot that stays stuck there, and often they might need to take a test for STDs. Women might need to take tests for STDs when it comes to if they have itchiness, or if you have vaginal discharge, as well as problems peeing, because it might be a sexually transmitted disease. So check that out if that's the case. And that is it about that. Incontinence, often a problem for older people, where they have no control over the bladder. But it's actually completely okay to have a little bit of incontinence if you're a woman, and for example, if you've had kids, or if you're just a very stressed individual, you might laugh really hard and pee a little bit, and that is completely okay. That is something that a lot of my female patients wonder about, because it's only muscles that are keeping it in. And so if you cough or sneeze or laugh very hard, sometimes it will leak a little bit. So long as you don't leak a ton at a time, because then there's something wrong. But it's okay to leak a little bit. And it's okay to have vaginal discharge, okay? That is, everybody has it if you have a vagina, okay, obviously. Would be hard to have that otherwise. But yeah, so that is about urinary problems. I don't know how many more of these I'm going to do, but that is all for today. Have a great day, everybody. Bye.